As the exam review, what I'll do is I'll just go over the PowerPoint for the exam, and everyone else has had exam reviews, so hopefully those were helpful. I don't really know, but was there any topics you guys wanted to cover that you don't think was covered well in the last exam review? No, nobody's answering me, so I'm guessing not. Let's see here.
It's just you and I.
No, it looks, I don't know. I mean, there's other people on here, but I don't know why they won't.
I just didn't hear what you said. I'm sorry.
It's okay. I was just asking if anybody had anything that they wanted to go over from the other reviews. It just seems like we're repeating the same stuff over and over
I have
again.
one question, Professor Lalani.
Mm-hmm.
Um, One thing I was reading about a baby that's like several hours old,
Uh-huh.
and if they having breathing difficulties,
Mm-hmm.
and their respiration rates are going down, um, and then they start back breathing regular.
Mm-hmm.
Uh, is that normal?
So they're breathing fine, then they're not breathing fine, then they go back to normal.
Right.
Yeah, that's okay. If they go
That's
back
okay.
to normal.
So, what nursing intervention you would do for them?
Well, you'd have to watch their respirations if they're not breathing properly.
Hmm.
Okay. And if they aren't, you can supplement with oxygen if you need to.
Okay. Okay.
You make sure that they don't have a fever. You want to make sure they don't have any of the other things that could cause difficulty, right?
Okay.
So those are the kind of interventions you would do there.
All right. That was one
Hmm.
question I was concerned about.
Okay.
Thank you.
Yep. Thank you for asking.
Mhm.
All right. So we have,
I have like three topics.
okay.
Sorry, I was trying to find it in my notes. I know one of them, like the thermoregulation, the four
Uh-huh.
different types,
Uh-huh.
and the different types of reflexes.
All right, so reflexes I covered in my class. I showed a video on it, and that seemed to be most helpful for everybody. I don't know. Did you find that helpful, Shalonda? All right, so I'm going to send that video in the
I
chat,
did.
okay? And I would say watch that because it's way better than me talking to you.
Okay.
Shows everything with a real live baby, and that's, I think, a little better than me going over it. I mean, we'll go over it in the review, but let me send you that YouTube that I showed in my class because it was really helpful and it goes through every single one of them. Let me just get that for you. When we take a look at, we're going to go back all the way, it's not that much material because it was only a couple weeks of material, but we're going to talk about choreo. So remember, that's the infection. Let me just send this YouTube in the chat. So this YouTube will show you the different reflexes and it should be really helpful for you to watch because I thought it was helpful for my class. All right, I put that in the chat for you. All right, so we're going to take a look here at choreo. Remember, is our infection that we have on the moms. So you want to, what are some of the kind of things you want to think about? Um, if she has a fever, uterine tenderness, um, anything like that, foul smelling fluids, right? You worry about those. So what are we going to do? We're going to give antibiotics and we're going to deliver the baby because you don't want the baby to get infected as well, right? So those are things to remember. Postpartum infection is when you have a fever, postpartum, greater than 100.4. You want to keep track of the lining of the uterus. If you do have it, we usually give prophylactic antibiotics with our C-sections. Mastitis is infection of the breast from breastfeeding. So you see fever, warmth, red like symptoms. So you're gonna have them pump a lot, warm compresses or cold compresses. We have postpartum hemorrhage. So we know that this happens postpartumly. And it's the failure of the uterus to contract back, right? So our early hemorrhage is going to be in the first 24 hours, and our lacerations is going to be, and hematomas is going to be our second cause of an early hemorrhage. Postpartum hemorrhage, atony is when the uterus doesn't contract, like we said, right? So you're going to give meds like Methergin. You're going to give Hemabate and Cytotec if you need to. You're going to make sure the patient is voiding. So if you have to, you have to put a catheter in there. Contraindications with our Methogen and hypertension, and our Hemabate and asthmatic. So that's something I want you to remember. So with Methergen, you don't give it to your hypertensives, and Hemabate, you don't give to your asthmatics. Hey, once you have that blood loss, you can have that hemorrhagic shock. And so you're going to look for cool, clammy, hypotension, weak and rapid pulse. We're going to make sure we maintain our O2 sats, assess for breath sounds, restore circulating blood volume, and we put things in there like blood products. ITP is when you go really bad, and that's going to be when you have that thrombocytopenia where you're going to have less than 100,000 platelets. So you're going to have severe hemorrhaging after a C-section or with vaginal lacerations. And we know that during pregnancy, we're going to treat that with corticosteroids and a platelet transfusion. All right, postpartum mood disorders is something that you're going to be assessing your patients for. You have the blues, which peaks around day 5 and goes away by about day 10. Postpartum depression is going to be a little bit more so. It's going to last more than 2 weeks. What are some things we can do for it? Psychotherapy and antidepressants. A lot of times they need to go on. There's postpartum psychosis, which is postpartum depression with psychotic features. So they'll have rapid, bizarre behavior, hallucinations, impulsivity. And so you want to really watch these moms because they're going to hurt the babies. You know, they have the potential to hurt them. APGAR scoring is what you do when the newborn is born. It's appearance, pulse, grimace, activity, and respiration. So remember, babies are going to tend to be blue extremities. They should have beats higher than 100. They should be stimulated or crying or sneezing. They should be moving. And they should have a strong cry, not as irregular and no breathing. All right, this is a case study that we go through. Maybe we'll do that. Oops. Sorry about that. Let's look at this case study. No, I can't find it. Oh, there it is. All right, let's start here. Molly has positive pressure ventilation with a bag and a mask and improves. By 5 minutes of life, she is crying, pink with blue extremities, has a heart rate of 120, and active movement. So what is her 5-minute APGAR going to be? So we're going to look, is she grimacing? What's her pulse? What's her respirations? So what do you think her 5-minute APGAR score would be? She's crying, pink with blue extremities, heart of 120, active movement with response to stimulation.
7.
So remember APGAR, we
A
just wanna-
9.
So she's crying, she's responding to stimuli, she's blue extremities, her heartbeat's 120, and she's crying. What would you get for appearance?
Who won?
Good. What would she get for heart rate? It's 120.
2.
2.
1 plus 2 is 3. What would she get for grimacing?
1.
Uh,
A 1.
I think she's a 2, no? She's a 1? Okay. I have to double check because I think she's
It
stimulated.
says grimace is 1.
Is 1.
Does she say she's grimacing? Okay. And then is she moving?
Yeah. Yes.
And is she crying?
Yes.
All right. So you're at an 8 or a 9 for an APGAR, right? And
Mhm.
then
My bad.
what else do we have? What should happen to Molly next?
I was cooking the chicken. It's off now, though.
We was at an 8.
Skin to skin.
Skin to skin. What else?
Eating another APGAR. I think it's 10 minutes.
Yep, you can do 10-minute Apgar.
10-minute app. Do a 10-minute app call.
So they want you to say she goes skin to skin for bonding. And so what feeding cues might Molly be exhibiting? What kind of reflexes might she be doing?
Rooting.
Good rooting where she's turning towards. What else? She'll start chewing on her hand. She could start crying, right? All these
Okay.
signs. And how soon after birth can she breastfeed?
As soon
Immediately.
after birth.
Yeah, right away.
Yeah.
All right, so newborn care, first 2 hours, we kind of went through this. You're going to dry them off really quickly, skin to skin, regulate their body temperature.
Yeah.
Promote bonding. Don't forget them. We're going to do within the first 2 hours, we do eye prophylaxis. We do erythromycin to the eyes. Vitamin K, we give into the thigh, right? To help with the synthesis, since we don't have much present in the gut. Here's where somebody asked about this thermoregulation, thermogenesis, and cold stress. So the way you thermoregulate, and the word says it right here, is thermo and regulate. It's a balance between heat loss and heat production. After respiration and circulation, it's most critical to survive. They really can't they can't dysregulate, okay? So they're going to lose it by convection, conduction, evaporation, and radiation. Thermogenesis is an attempt to generate heat by increasing muscle activity. So we have that non-shivering thermogenesis. And then we have cold stress. We have all the different types. We have anaerobic, metabolic, hypoglycemia. So what do we try to do for these kids? Dry them, keep them warm, hat, blanket, so that we can help with their thermoregulation. All right, guess we're looking at the GI system. We have feeding behavior related to the gestational age. You have GERD, which is spitting up. Stools should be meconium based. Transitional by day 4, we're going to say yellow with breastfeeding. So it goes from that meconium color to yellow. Respiratory rate should be between 30 and 60, right? So what are things we look for with respiratory distress? We're going to look for flaring, gasping, grunting. And I was telling my class to actually grunt, like you could hear it. You'll see retractions. So if you have any concern about respiratory distress, what can we do? We can see things that we do for them. So we can do supplemental oxygen, right? We can watch their pulse oxes, see how quickly those go up. Our bilirubin, we know, is excreted in feces. So we want to make sure we feed every 2 to 3 days. And to reduce our bilirubin levels, we're trying to get them to poop it out, right? Phototherapy is something we use to reduce bilirubin. If you look at the baby's hand right here, see how yellow it is? So yellow tint, you'll see it in the skin and in the eyes. And so we want to make sure we get rid of that. If you have acute manifestations of toxicity, you can have seizures, lethargy, coma, death, all of those. All right, we took a little look at, during this week, we looked at skeletal and peripheral nervous system injuries that can happen. We have different clavicle fractures with shoulders, if the head gets stuck and the shoulder has to come out. We sometimes see uneven folds in the hips, and that can be your dysplasia. Newborn head, know that you have molding, which is a distorted shape from overlapping cranial bones to help the body's head come out. So if you look at this picture right here, this is a great picture. This will show you where the fontanelles are, okay, if you can see them. So when they're depressed, they're probably dehydrated. So if they're sunken in, if they're bulging out, then you probably have some increased intracranial pressure there. All right, so we have swelling over the scalp, which is a normal finding. The head just gets mushed in some way. Usually disappears in 3 to 4 days. A hematoma is when you have a collection of blood, so it does not cross the suture lines. And we have increase of bilirubin there because you have to try to get rid of that. Here's your reflexes, which we covered in class tonight, and we'll just go over some of them. Here are the ones that you need sucking, so the baby should be able to suck, right? And root means look towards where the food is coming. The startle, which is right here, when they hear a loud noise, a banging noise, then they'll jump. And then Babinski is with the foot. When you run your finger down their foot, it should fan open. So those are all normal. We'll look at the skin. We have this like yellow covering in this picture right here, which is like a protective antimicrobial. Acyanosis on the hands and feet, which is normal. You can kind of see that in the first 24 hours. Mongolian spots are going to be those bluish black pigments right here that are most common on the back, and buttocks most common on dark skin. And lanugo is the fine hairs that we see on the baby that often disappear during the first week of life. So we see these things on the skin here. These are newborn problems in the skin. Oops. That you can have. We're going to skip over for you. All right, reproductive. Sometimes increased estrogen in pregnancy will cause excessive genitalia, so swelling. And it's like breast buds, actually. All right, so what are some teaching and discharge planning we're going to do? We make sure that we keep the temperature warm. We take their temperature and tell them when to call the doctor. With respirations, we know there's going to be normal variations, so we'll bulb suction, and we want to make sure we're not putting any blankets or pillows in there. Feeding patterns on demand as the baby needs it. 6 to 8 wet diapers a day. We're going to have them sleeping supine with their head elevated, but we are not going to put pillows around them. Make sure you have a car seat that's ready to go. What they speak of is thumb sucking and pacifier use helps to prevent SIDS, so that's a positive thing. And cord care, you just keep it dry. All right, our drug exposed infants, they can be exposed to anything, alcohol, drugs, tobacco, anything. No opioids and illicit substances cross the placenta and breast milk, so they can't be breastfeeding. Methadone is acceptable when breastfeeding as long as we're not using that with something else. And the degree of infant withdrawal is going to relate to the drug and how often it was taken. And so we look for signs of withdrawal as a priority, right? So you're going to look for those high-pitched cries, irritability, seizures, tremors. GI, you're going to look for poor sucking and vomiting. Their stomachs are going to be not really happy to have food because they want the drugs back in them. So you're going to swaddle them snugly, hold them tight, decrease stimuli, keep it dark in the room if you can. They're going to be really needy of love and attention. So you're going to help that mom with that kind of thing. Our preterm infants are born before 37 weeks. We have immaturity of our body systems. We have surfactant deficiency, which is in our lungs. So if we have that, then we won't have as great breathing. So you'll see these kind of breathing tools on them. And the littler they are, the greater potential of disabilities. All right, infants of our diabetic moms are going to be macrosomic on our gestational diabetic moms particularly. They're going to get that hypoglycemia because they have excess glucose in utero, which has caused the baby to produce more. And so you'll see that sometimes. All right, and then we have our positioning and our latching with our breastfeeding. You can see the moms doing all different positions here. So making sure you're recognizing that you recognize feeding cues. Priority with the first feeding, you want to make sure you see that. Latch assessment, just make sure they're latching. You can hear a swallow and the comfort level of the mother and different positions. We talked about this in class. You don't want to always use the same position for effectiveness of breastfeeding. So for a mom who's breastfeeding, she needs to add 450 to 500 calories a day. Well-balanced diet. Don't put any soap or creams or lotions on the breast. And just remember, it's not considered an effective method of birth control. All right, so formula feeding, if you're not breastfed, they should receive iron fortified formula. Feed every 3 to 4 hours, 6 to 8 hour feedings in 24 hours. So it's a little different than when you're breastfeeding because you're breastfeeding on demand. All right, here we have some math. Let's look at our questions here. The nurse assist with the birth of a newborn. Which nursing action is most effective in preventing heat loss by evaporation? Remember, evaporation is when the water goes up and away. So how would you prevent evaporation? You can put it in the chat if you want.
3.
Okay, and remember, evaporation is going to be heat that comes off of moisture. So you're going to make sure, here's some different examples to prevent the newborn by drying the newborn, preventing hypothermia via evaporation. And then we know that heat from the newborn's body is transferred to a colder object with direct contact. So warming the crib will help with conduction. Convection is as air moves. So you're going to keep the door closed and heat is transferred in that way. And then radiation when the newborn loses heat because it goes to a colder surface. Alrighty. Admission of a 43-weeker with APGAR scores 1 and 4. In planning for the admission, what is the nurse's highest priority? So APGAR score of 1 means it's barely doing anything.
One.
Somebody said 1. Let's take a look and see. Our answer is number 2, right? Which is going to be connect the bag to the oxygen outlet, because an APGAR of 4 is going to know that respiratory is not very good. So they all would help, but they're going to be needing that respiratory support is our primary. Okay, remember airway, breathing, circulation. Let's see here. The nurse administers ointment to the eyes of a newborn, and the mom asks why. What explanation is best for this neonatal eye prophylaxis?
Four?
So all babies are going to get this, if that helps with the answer. But not all of them are going to have this, but it's a combination really of 3 and 4, because you're making sure that they're going through a dirty canal. So it's a prophylactic for gonorrhea, but we're going to make sure that we administer it to all our babies, regardless what they have. All right, that's 7. The nurse is caring for a term newborn. Which assessment finding should alert the nurse to suspect the potential for jaundice? Remember, which one is going to cause jaundice among our babies? We just talked about the hematoma. Remember, that's an increased risk because it's a hemorrhage going on. So it's going to have our increased risk for an increased bilirubin load. So be careful with that one. Let's see here. SGA, small baby, goes to the nursery. What should we think of as a priority on a small baby? Anybody?
3.
Yeah, why are we worried about glucose on a small baby?
Maybe aren't
Um,
metabolizing properly?
Yeah, it's
Or
most common to see that. Yep, to have hypoglycemia on our little babies because they can't accommodate because they're little. All right.
So that's for the small and like microscopic hypoglycemia.
Yep, it's hypoglycemia overall. Not one specific type, correct. Which newborn is most at risk for a brachial plexus injury?
Three.
Good, that's gonna be our
3.
fractured clavicles, right? Those heads are coming out and then the shoulders get stuck. The nurse is preparing respiratory distress syndrome. What initial action should she plan to facilitate?
Mm,
What do you think is going to be really important for that baby?
one.
Good. Why'd you say one?
Because they want to swaddle them. They want to keep them close and cuddle with them.
Yeah, and so a lot of times parents will get turned off if the baby's not turned off, but they will feel uncomfortable. The baby's struggling, so you want to continue that bonding because that initial bonding is really important. All right, breastfeeding postpartum client. Which instructions should the nurse include?
Three.
Should soap
I'm
be
sorry.
used to
That
clean the
should
breast?
not be. I'm sorry. Not that one.
What do we know is required? How much more do we need with breastfeeding? You need more calories, remember? More fluids, right?
One.
Because it's draining the fluids out of you.
Mhm.
All right, new mother at home 24 to 48 hours after discharge. What should the nurse expect to note in a healthy mother who's breastfeeding her newborn infant?
Two. Oh, wait, no, hold on.
Remember, what is normal?
Normal. Hold on, wait. Normal. No. Head turned towards the breast and toward the flat arms. The mother has sore nipples and infant has suck blisters. The mother is breastfeeding. Tummy position without. Oh, 4.
4.
Yep, no signs of cracked nipples, burst of suckling, and then they pause and swallow. That's demonstrating that it's
Yep.
effective breastfeeding, right?
Yeah.
All right, good. All right, respiratory distress syndrome is diagnosed, and the primary healthcare provider prescribes surfactant replacement therapy. Which route should the nurse prepare to administer this medication? I don't think I covered this in my class, but in 4, surfactant is going to be given through endotracheal tube. Okay, so
Mm.
remember, you're not going to do anything orally with a baby who's having respiratory distress, right? Because they're having a hard enough time.
Right.
And then subcutaneously, you don't treat with surfactant. Surfactant's thick, so you're going to do it through an NG tube. I mean, see, an endotracheal tube. Okay, just remember that about surfactants, thick. All right, any questions on the review? No.
No.
All right, I will post this review and you guys can listen to it if you want to over the content and things like that. Are there any questions I can answer for you that I haven't answered as of yet?
Oh, ma'am, I'm
Just make sure you guys practice your math, okay? Because you got your 5 math.
all right. Thank you.
All right.
Thank you so much.
You're welcome. Take care. Hi guys, I know I'm supposed to meet with both of you.
Okay.
I just had kind of a crazy